Hi everyone, my name is Spandana. My student number is C23077836. Today I am going to talk about my poster and the topic is does poor Apgar score in extreme preterm infants have significant impact on neurological development outcome? Before going into the topic, I am going to talk about IVH. IVH is a major problem commonly seen in preterm infants who is requiring medical intervention. The main causes of IVH are the fragility on the blood vessels of germinal matrix, any disturbances in cerebral blood flow, platelet and coagulation disorders, sepsis, seizures increase the risk of IVH in preterm infants' brain. The overall incidence of IVH among the extreme preterm infants is 25 to 30%. As soon as baby delivers, we assess the clinical condition of the baby by using a score called Apgar score. In this Apgar score, we assess the color, heart rate, respiration, tone and reflex of the baby at the time of birth, 5 minutes and 10 minutes subsequently. There is an extended Apgar scoring system and it is the same as original Apgar scoring system, but it is recorded at 10, 15 and 20 minutes of age. The main objective of this poster is to compare the effects of low Apgar on long-term neurological outcomes. In this, the infants who were delivered before less than 28 weeks of gestation were included, and in this we have divided into 4 different groups based on the Apgar scoring. In the first group, the infants who were scored 0 to 3 were included in the group 1, 4 to 6 included in the group 2, 7 to 8 included in the group 3 and 9 to 10 included in the group 4. The ethical approval was taken and cognitive and motor ability was assessed by Welshire Preschool and Primary Scale of Intelligence. In this paper, the two outcomes were assessed, the short-term and long-term outcomes, and in short-term outcomes, intraventricular hemorrhage, post-hemorrhagic ventricular dilatation, PVL and hydrocephalus was assessed. In long-term outcomes, cerebral palsy, spastic diplegia, motor disability like hypertonia, neurological developmental delay, cognitive delay and speech delay were assessed. For review of literature, I have taken 3 papers, and in the first paper, the study done by Gamble et al., the low Apgar scores were associated with increased hospital visits, neurological abnormalities and low IQ. As p-value is quite significant and it is significantly associated that Apgar scores are related to neurological abnormalities. And in the study done by Shukla et al., there is a 16% of mild disability and 38% of moderate to severe disability with for the infants of Apgar score 0 at 10 minutes of life. But the area under the curve was only 0.56, which is quite low. According to Erhard et al., there is no correlation between no Apgar scoring and IQ and motor function. As per in the discussion, I have noted that Apgar score is Apgar scoring documentation of Apgar scoring requires teamwork, and it is subjected to inter-observer variability and observer bias. However, in the spirit of a team, we agree on the scores before documenting. In a study done by Gamble et al., small head circumference and low Apgar scores were found to be predictors of neurological, cognitive and psychological abnormalities. According to Shukla et al., Apgar score alone does not predict the death or disability. Risk predictive accuracy enhanced when combined with other variables. In a study done by Erhard et al., it is found that effects of Apgar score of 3 or less on motor activity for all children was not statistically not significant. So I have in my conclusion, the current available data is insufficient to conclude association of Apgar with a pure neurological outcome.